Okay, the purpose of this speech, hi, my name's Tiana Lee. The purpose of this speech is to inform you guys about the benefits of using aromatherapy and soft music to increase appetites of patients in the long care facility. Incorporating these two combinations will have an increase on their appetites, and it has been proven. Oftentimes in the long care facility, residents tend to have a decrease in their appetites for many reasons. Reasons ranging from their disease process, a sudden change in their living situation, behavior changes, or the type of medication that they're on. All these things can play on your mind and activities of daily living, such as bathing, eating, just doing things for yourself that requires a lot of help from the staff. Oftentimes the residents will not be interested in eating their foods just because of the situation at hand. There are a lot of ways we can change that from happening, but the two I'm going to discuss today were, like I mentioned earlier, the essential oils and music therapy. I started working in a long-term care facility when I was 19 up until I was 14, and I will often see residents come in unhappy, nervous about their current situation, just not knowing what to expect. Incorporating these two methods, aromatherapy and soft music before meals, showed an increase of their appetites, and residents went from eating 25% to 100%. So it has been proven, like I said before, that these two things in combination can increase the resident's appetite. Let's get into a popular disease that plays a part on a decrease in residents' appetite. The loss of appetite is a recurring problem in a long care facility, often due to a disease called dementia. Many patients in a long-term care facility have a disease called dementia. It is a chronic disease that interferes with the impairment of at least two brain functions. These two brain functions are the hippocampus and the temporal lobe. Dementia causes behavioral changes, memory loss, and judgment that interferes with daily functioning. According to Kai, Hashimoto, and Ikeda, eating is one of the most important daily activities in managing a patient with dementia. And this is a well-known disease that most people in long-term facilities struggle with. Along with dementia, patients lose the ability of smelling or tasting their food. So often you might see staff members adding sugar, incorporating ice cream before bites, just to get them to, want to be interested in eating again. So now that we have got familiar with that disease process, let's talk about ways we can increase their appetite. Okay, first, essential oils such as lavender and rosemary are very popular and are known to have a positive effect on increasing a patient's appetite. The scent of lavender is known to have a calming effect that helps balance emotions and behaviors. This scent works well with dementia patients because that particular disease affects their mood and aggressive behavior. Lavender can be delivered through the nose or topical, such as creams and lotion. It doesn't take a large amount to deliver this product, these essential oils. I have seen in nursing homes when nurses will plug in candle warmers with this particular scent around meal times. Over time, we see an increase in their appetite, or residents start asking, when is it going to eat? Is it time to eat? They're getting hungry. Their stomachs are getting to moving because they're smelling that good scent of lavender. The other scent, a popular scent, is rosemary. This is known to have an uplifting and a stimulating effect on the mind. According to Sauer 2015, rosemary is an uplifting oil used to stimulate the mind, and the body. This essential oil can be used as a topical cream as well, sprayed through a room like an air freshener, or through the nose as well, just to breathe it in. Rosemary also treats signs and symptoms of depression, constipation, which are other factors that our elderly patients face. Often, you get older and these things aren't working like they used to. So these things going hand in hand with the loss of appetite. So now that we talked about the two essential oils that are, familiar to use, let's talk about how soft music can contribute to the increase of appetite. Music therapy can be beneficial in promoting an increase in appetite as well as decrease in behavior and psychological symptoms. According to Reed 2016, music has been shown to influence the intake of food and fluid. It can do this by affecting and regulating mood states and increasing arousal by changing physiological responses. Introducing patients into a calm environment relaxes their state of mind and helps them become more focused at meal times. I know when I like to eat, I like to be, no TV on, quiet, might play some soft music just to set the mood and the tone a little bit to get ready to enjoy my meal. In hand with essential oils and music, it is great to figure out what type of music your patients prefer. This will not only help them feel involved in their decision making, but it'll also make them more familiar of the setting. These two combinations have been proven to be effective in increasing the appetites in the long care facility. Everyone can help in reaching this goal, from nurses, nursing assistants, to the staff and activities department. Working together collectively to meet the needs of our patients can make for a better environment for us and them, but more importantly, decrease the mortality rate associated with appetite, the loss of appetite. So, in conclusion, making sure our residents eat on a daily basis is very, very important, and it doesn't take little to no effort to just take that extra step into seeing what type of music they like. Getting a scented candle or air freshener. Just try these little things to help increase their appetite so, they can have years and years more of living and enjoying life. So that's all I want to say today, and thank you.